Today we're here in Colonial Heights and we're at the Eyelight Vision Center, and I'm joined by Dr. Ben Alig. Doc, thanks for having us out today.
Thank you for being here.
Let's talk about Eyelight Vision Center. We're kind of going to take folks through the patient experience here. When they walk in the door, they come here first. This is their first stop. It's your diagnostic center. What happens here?
Well, as you can see, we've got quite a few instruments. When I first started out, we only had 2.
Right.
And now we have 8. So we've come a long way in optometry. So I guess we'll start off with the newer instrument. It's called the OCT, which stands for Ocular Coherence Tomography.
Oh, wow.
And
better to call it OCT.
OCT, for sure. And then what it's really done is changed the way we analyze the retina, the optic nerve, the anterior segment. It's like sort of like an X-ray, but it lets us see through all 10 layers of the retina. So it's a really important piece of equipment for our diagnosis and treatment, especially like glaucoma.
Yes, but you got a couple other pieces of equipment here you want to talk about as well.
These are the ones that's been around for a while. This measures the pressure of the eye.
Right. And
this is a screener for visual fields, but then we have a bigger one that gives us more in depth for visual fields. That's part of glaucoma treatment and diagnosis. And then we have an autofractor, which helps us, it gives us a starting point for the patient's prescription.
In addition to the OCT, you have a retinal camera too, and what does that do for us?
Now this takes a photo of the retina, the optic nerve, and the macula, and it's especially helpful in the diagnosis of diabetes and other eye diseases, but especially diabetes.
All right, we've moved from the diagnostic area here to the examination room, doctor. And the great thing is you can take the information you got in the diagnostic room, put it on a computer right here, and make sure you got all the information you need before you even put them in the exam chair.
Yes, correct. So now I've got this, it shoots in from the diagnostic room. So then now I can look at your whole retina.
And this is from the retinal camera that
yeah,
we were showing.
The one we just took of you. And then, so this lets me look at the blood vessels, the optic nerve, the macula, and the general view of the retina. So that's really important in diagnosing diabetes.
And also you have the images from the OCT as well.
Right. And this is the OCT, which we can look at a few scans.
And this is telling you the thickness of the retina, and what else is it telling you?
Well, the thickness, it actually tells us in microns. You got 95 microns of macular pigment tissue, which is really good. So it could pick up separations of the retina. It gives us information for glaucoma and diabetes and macular degeneration, quite a few different diseases of the eye.
Doctor, we're looking at another retinal camera picture here of another patient, and one of the things that you're looking for are hemorrhages of the blood vessels in the eye.
Yes, and in this patient, if you can see that, it's a tiny, tiny dot hemorrhage. So without this instrument, it would have been very hard to see such a tiny hemorrhage. This retinal photography is really important in diagnosing early stages of diabetes in the retina.
So very important, because a lot of times your overall health can be found through your eyes.
Yes, sometimes we're the first one to actually diagnose diabetes, which would rather not be that way. That means it's been going on for a while if it's showing up in the retina. But yeah, and then we can communicate with the primary physician and let the primary physician know that there's some diabetic retinopathy going on.
Okay, after you've taken in all of this information here that you've gathered in the diagnosis area, you actually put them in the chair and do a regular vision examination.
All right. We do this, and then a lot of times we'll have the OCT scan also. So, yeah, before we even start talking with the patient, we have all this information.
Very good. And from here, you head out. If they're needing new glasses or they're needing contacts, you head out to the lobby area, and they get to pick out frames and lenses and things of that nature.
Yeah.
So we're going to be heading out there next. We've been through diagnosis and examination with Dr. Ben Alig, and now we're up front here with Pam Brooks at Eyelight Vision Center. Thanks for showing us around out here today. And we're talking about prescription glasses and contacts, and y'all have a great selection here. And I know there's a lot of folks out there using their computer and iPad. Do you have lenses and prescriptions that can help those folks?
Oh yeah, definitely. There's many different options. We have lenses to fit every lifestyle need.
And let's talk about designer frames. I'm looking back through here. You have hundreds of selections here. You have a lot of great designers, don't you?
We do. We try to carry most of the top line designer frames, as well as they are not quite as expensive, so that it will fit into everybody's budget.
And I know a lot of folks like myself, we have our prescription, but a lot of folks need sunglasses, and you can get your prescription made into sunglasses,
Correct.
can't you?
Actually, everybody should have a pair of prescription sunglasses.
And so Eyelight Vision Center, a great place to come and take care of all your eye care needs, right?
Come by, we'll take care of everything you need.
All right, Pam
Yeah.
Brooks, thank you so much.
Thank you.
Thanks again to Dr. Ben Alig for everything. We've been out here today at Eyelight Vision Center here in Colonial Heights. If you need anything to do with the eyes and your eye care, this is the place to come.
The preceding portion of Daytime Tri-Cities was sponsored by